Us now with her reaction is Barbara Kennelly, the president and CEO of the National Committee to Preserve Social Security and Medicare. She's a former congresswoman from Connecticut who was a ranking member of the Social Security Subcommittee and a former counselor to the Social Security Administration. Ms. Kennelly, welcome to Bloomberg News. And Lindsay's report painting a very dire picture. The trustees saying that Social Security will be depleted, the fund will be depleted by 2037.
Well, first of all, always the reporting on Social Security is dire. The fact of the matter is, last year, the trustees said that Social Security could pay full benefits to 2041. Now they're saying 2037. Would you notice that that's 3 decades away? The whole program has been planned for the long term to have these kind of economic cycles going up and down. In the 1990s, Social Security could only pay to 2000, say. But no, these figures, Social Security is not going bankrupt. Social Security has a surplus. It can pay full funding to 2037. That's what the trustees are going to tell you.
So, Ms. Kennelly, where's the disconnect between what you're saying and some of the things that Lindsay was telling us are in that report?
Well, Lindsay is reporting, as people report, and saying, hey, the number went from 2041 down to 2037. And, you know, that is a drop. And are we surprised? No, we have a recession. Are we surprised that, you know, tens of thousands of people have been laid off and not paying into the payroll tax? But the Social Security program has been designed specifically to have these economic going up and going down. I was on the committee in 1983, the last time we reformed it. We raised the payroll tax, we raised the age because we knew the baby boomers were coming. So no, Social Security is not going bankrupt. Do we have a problem right now? We have a fiscal problem. We've got a deficit problem. We don't have a Social Security problem because we have that surplus. Now think of the good years we had in the 2005, 6, 7, 8. So much more money was coming in from Social Security from the payroll taxes than was going out. That built up the surplus. And so that's the base we have right now. That's why you can go out to 2037 and say Social Security can still pay its benefits.
Are you saying that the system's not, are you saying that Social Security is not in need of reform?
Oh, no, I'm not. And you said that at the beginning of the program. No. The out years, when you say that Social Security can only pay full benefits to 2037, of course we can address those out years. But don't forget, hundreds of thousands of people are working, paying in. People act like everything stops. No, there's all sorts of ways that you can take a little here, a little there, and you should do it now rather than later so people can plan for their futures. No, I think Social Security should be reformed. What I don't think is Social Security should be used as a scapegoat, that now we have all these problems in the economy. Okay, let's cut benefits. Let's raise the age. That's not the right way to go.
Well, the same question, I guess, applies to Medicare. What type of reforms might be needed for Medicare?
Oh, let me tell you something. You're not going to hear me defend Medicare the way I'm defending Social Security. Medicare has serious problems because we have serious problems in our health care system. And if Barack Obama, as I think he will, reforms health care system, Medicare will do a good job.
And Ms. Kennelly, I'm sorry to cut you off, but Treasury Secretary Tim Geithner is speaking right now in Washington. Let's go to that live here on Bloomberg Television.
Dedication of the chief actuaries, Stephen Goss and Richard Foster, and the hard work of their staffs. For generations, tens of millions of Americans have been able to count on Social Security and Medicare as guarantees that they will be able to live out their senior years in economic dignity and with health security. This year's trustee reports once again remind us that the longer we wait to address the long-term solvency of Medicare and Social Security, the sooner those challenges will be upon us and the harder the options will be. The sooner we come together to make the difficult but achievable changes needed to strengthen the solvency of Medicare and Social Security, the more time we'll give the American people to plan and to adjust, and the sooner we'll be able to ensure that these vital programs will be as important for generations to come as they are today. That's why, even as this president has focused on pulling our nation out of recession, he's made clear his commitment to work in a bipartisan way to address the long-term health of Medicare and Social Security. Reestablishing fiscal sustainability, fiscal responsibility, as well as the strength of these two vital programs is essential to the economic and health security of our country. The Medicare Trustees reports makes clear today that there is no more important long-term fiscal policy measure than gaining control of the growth of Medicare costs by delivering health care services more efficiently. These savings can only be achieved in the context of a larger effort to control health care costs and improve quality more generally. The most effective entitlement reform measure will be a major health reform that helps bring down the growth rate of national health care spending. The administration is committed to working with the Congress to find ways to control runaway growth in both public and private health care expenditures while helping ensure that all Americans receive the high-quality, affordable health care that they deserve. The recent commitment of major health stakeholders to help lower the annual growth rate in costs by 1.5 percentage points represents a crucial step in that direction. Now, the trustees' reports come to the following conclusions. Let me just summarize these briefly. First, the Medicare program's financial challenges are larger and more imminent than those of Social Security. Medicare faces demographic challenges, rapidly growing health care costs, and the short-term outlook has been hurt by the recession. Medicare's annual costs were 3.2% of GDP in 2008, or nearly three-quarters of Social Security's, but they are projected to surpass Social Security expenditures in 2028 and to reach 11.4 percentage points of GDP in 2083, compared with only 5.9% for Social Security. Medicare's Hospital Insurance Trust Fund is projected to become exhausted in 2017, 2 years earlier than projected in last year's report. The cost of Medicare's supplemental medical insurance to the federal government is projected to increase rapidly. General revenue financing for SMI is expected to increase from about 1.3% of GDP in 2008 to over 4.7% of GDP in 2083, with continuing increases beyond those 75 years. Now, this year's Social Security report projects that the trust fund will be exhausted in 2037, 4 years earlier than the trustees projected last year. This change is primarily due to the economic recession, recent data that prompted a small downward adjustment to the projected level of real GDP, and the fact that our citizens are on average are projected to live longer lives. Nevertheless, Social Security can continue to pay full benefits for nearly 30 years and cover approximately 75% of scheduled benefits thereafter. Now, to ensure that these critical programs are there for future generations, the President and this administration are taking the following steps. First, we're intently focused on bringing the current economic and financial crisis to an end and getting on with recovery. The return of robust growth will help solve some, but by no means all, of the financial problems of Social Security and Medicare. Second, we're reforming the healthcare system to get costs under control and improve quality, which will help strengthen the Medicare program and improve the long-term fiscal position of the United States. Just yesterday, as I said, the President, working with major healthcare providers, helped secure a commitment to reduce future growth and costs of care by more than $2 trillion. These voluntary efforts will complement the President's efforts to enact comprehensive reform to assure quality and affordable health care for every American. And the administration is committed to working with Congress to find ways to control runaway growth in both public and private health care expenditures, while, as I said, ensuring that all Americans receive the high-quality, affordable care that they deserve. And finally, after we have passed health care reform that puts our nation on a path to lower growth in health care costs and more expanded, more affordable coverage, this President will work to build a bipartisan consensus to assure the long-term solvency of Social Security. The President does not believe that Social Security is untouchable politically. He believes there's an opportunity now for a new consensus on Social Security reform. The steps the administration is taking towards comprehensive health care reform, towards economic recovery, and towards deficit reduction over the medium term will all help preserve Social Security and Medicare for future generations, and they will help produce a more balanced and more sustainable growth that improves the lives of all Americans, both working Americans and retirees.